So welcome everyone to today's mock session on communication skill. It is held by MRCS Insights Group. As you all know, this there there will be two communication stations in the exam apart from the history taking stations. In one, you have to communicate with the patient or patient's relative, and in another one, you'll have to make a phone call with the consultant. Each of these stations will be preceded by one preparatory stations, which will last for 9 minutes.
Yusuf,
Okay, you all know that,
ask
but
Bishop
I'm
to
just
read the rights now. They just make a back for me.
okay. I'm just reminding you the station rules. You will have the patient file in the preparatory station. You will have pencil and paper, and you have to write down the patient's details in that pencil and paper. And after that 9 minutes, you will have 1 minute to read the stem on the door, and whole 9 minutes to either communicate with the patient or to make a phone call with the consultant. Okay. So what to write in those 9 minutes? You have to write the patient details like patient
Is it
name,
that one? Oh,
date of admission, date of surgery, and date of investigation. Then your details like name of the hospital you work in, your level of training like ST1 for example, and the name of your consultant. And at the same time, you have to write down the name of the consultant you will speak with and purpose of the call like transfer of the case or ask for advice or update him with the case. And you also have to write positive clinical, radiological, and laboratory findings. Remember, some of the informations will not be in order. You have to write them down in order. Okay. And some extra information can be added or changed to the case notes or patient file, which are not included in the study materials. So my advice is to you, note down every relevant information which may seem important. Okay. So now what we'll be doing is telling you about the checklist and mark distribution for the communication station. As you can see, in communication with the patient or relatives, there will be one surgeon and one layman examiner will be present. And most of the marks, like 12 marks, will be distributed in the communication part. On the other hand, in communication with a surgeon or to make a phone call, you have to talk to a surgeon where marks will be equally distributed between communication part and the professionalism part. Not okay. In professionalism part, you have which includes decision making, problem solving, situational awareness, judgment, organization, planning, and patient safety. And in both of the stations, you'll get about 4 marks for clinical knowledge and its application. Okay. So now that's about the station. Before we start, I have to show you another thing. Bear with me. Okay, can you see my screen now? Am I visible, everyone?
Yes.
Okay. Can you see the timer?
Yes.
Okay. So I'll be having one sample station for you guys where Mrs. Nishat will read the stem and answer the questions within the 9 minutes time frame. Okay. So
Okay.
you'll have 1 minute to read the question and another 9 minutes to communicate. I'll start the timer now.
Hello everyone, I am Dr. Nishat. I am now reading the stem for you. Middle-aged male patient has fractured ribs and subcapsular hematoma, but he is hemodynamically stable. Hemoglobin falls from 10 to 9. Patient is under conservative treatment. Patient wants AOR discharge because he has an important interview in the next day. Also facing financial difficulties because of his wife's new diagnosis of cancer. Now he decided to leave the hospital. You have been asked to talk to him.
When the timer hits 9, you have to start talking. Okay. Like include whenever you enter a station, start with your candidate number.
Okay.
Your time starts now.
Hello, my candidate number is 55. May I proceed?
Yes, please.
Okay.
So start. You can start.
Okay.
Start with the introduction.
Hello.
Hello, start with the introduction.
Okay. Hello, I am Dr. Nusrat, one of the surgical doctors. Uh,
Okay.
I have been told that you want to leave the hospital. But before that, I want to explain you about your cases so that before you leave the hospital, you can decide what to do.
But doctor, staying in the hospital is too much frustrating for me, and I also have some important things to do.
Oh, I'm really sorry. I understand your situation. But before that, I want to explain you your condition. Okay. So you have a condition which is called splenic hematoma. It's a condition which means there is collection of blood around the coverings of your spleen. And spleen is an organ which is situated in the right upper corner of your tummy. Okay. And this condition is happening to you because of your fractured ribs. And also we can see that your hemoglobin, which means your blood count, dropped by also 1 gram from 10 to 9, which gives the possibility of there may be some continued bleeding, and it may lead to some serious deterioration to your condition. Even it may endanger your life. So I think it's not wise to leave the hospital right now. Is that okay?
My doctor, what to say? My wife is also very sick. She's recently diagnosed with cancer. I need to take her to a doctor.
Okay, I'm really sorry about your wife. I definitely understand your situation, but I also want to consider your own health, okay? Because if you can't take care of your health, if something bad happened to you, then there will be no one to see your wife. And in that case, maybe your wife's condition will be worse. I am afraid of that. If you want, in that case, I can arrange with some of our, social workers to find a way, and he or she may help to your wife until your condition improves. Is that okay?
Okay, doctor, but I have a economic crisis going on, and I need to get that job. So that's why I need to attend the interview. It's very important for me. I need to go, doctor,
Okay,
please.
okay. I understand your situation right now, but I also need you to reconsider your decision because you should take care of your health first. Okay, and whenever you recover from your condition, you could search for another job definitely. Okay.
Okay, doctor, but I need to go. As I have told you, I need to attend this interview. Please make necessary arrangements for me to leave.
Okay, definitely. I will consider your situation. I also want you to know that people are only kept in hospitals when there is any absolute necessity. Okay, so uh, can you repeat for me what I have told you about your condition, please?
Well, you've told me I have a bleeding going on around an organ called spleen, which is situated in
Yes,
my tummy,
yes,
and my
yes, yes,
situation may get worse, but still I want to get discharged.
yes. Yes, you understand me properly. So, as I can't discharge you medically, so you will have to sign a legal document, which will be stating the exact details of your cases. And also, there will be stated that continued admission was medically advised to you. And I have also explained to you the potential sequences, but you want to take the responsibility of any adverse outcomes and you want to leave. Okay, so here is the form. You have to sign it.
All right, doctor, I'll sign it for you.
Okay, so let me tell you about some danger sign. If you feel drowsy or if you are having severe tummy pain, these are the danger signs when you have to seek help. Okay, so please contact with the accident and emergency department immediately, or I will leave my bleep number in the nurses station. To whenever you need, please contact us immediately. Okay.
Okay, doctor.
Okay, so please let me summarize what we are going through. Okay, so Mr. You have decided to self-discharge and you are going to sign an appropriate documents before that. And I have already explained the adverse outcome which may happen because of this premature hospital discharge. Okay, and you understood all the adverse effects and all the risk of not being in the hospital, which includes becoming more unwell or even it may endanger your life. and you have accepted all the responsibility of those risks. And also, I have discussed with you all the danger signs, when to go, which to look for, and when you have to return to the hospital for help. Okay, we are
Okay.
all there to help you and support you. And also, we will guide you a hand at any time. So, if you have any inquiries, please do not hesitate to contact us at any time. I will leave you already told that my booth number in the middle station. Okay,
Okay,
so
doctor. Thank
for
you.
your understanding, is there anything you want to ask me?
No, doctor. That's all.
Okay, thank you very much for your understanding.
Thank you, doctor.
Okay.
Okay, Miss Nisha, nicely done. You had a problem with the starting, but after that, you cope up with nicely. You didn't use any medical jargon, but at the same time, you told the spleen to be in the right side of the tummy. So, which is,
Oh,
the information is wrong. And you also
sorry.
empathized with the patient. And as we are not, video mocking, then we cannot see the eye contacts, but it's better to always keep the eye contact. And apart from this, your performance was great. Okay, thank you.
Okay.
So in this case, you all see discharge against medical advice or drama cases. First of all, you have to start with the introduction. Like you have to make yourself, available for the patient by saying, "Hello, I'm Dr. X. I'm one of the surgical doctors here, and I have been told that you want to leave the hospital," and so on. It's not necessary to confirm the patient details, as it's expected that patient details have already been confirmed. But if you want to ask for the patient's details in one line, you can directly ask for by the name of the patient by asking, may I confirm I'm talking to Mr. Smith or any other patient name?" Okay. Then let's come to the explanation part. After that, you have confirmed. After you have confirmed and introduced yourself, you have to explain the situation to the patient. Like in this case, there was a splenic hematoma. So you have to explain, like, which means a collection of blood around the capsule of your spleen is situated in the left side of your tummy and all. And after that, question and answer session starts. And in question and answer sessions, always keep in mind to use layman language. Don't use medical jargons, as the layman examiner will be uh, marking you for that. And actively listen, like sit on the edge of the chair, head nodding, and eye to eye contact. And use your body language, which includes your hands and facial gestures, but don't overuse it or overdo it. Okay. And show sympathy, offer a seat or apologize, but make sure never to touch the patient. Always you offer to help, and give warning shots before breaking the bad news. Now, about the summarization, it's always better to summarize if you've got enough time left, because not only it will carry marks, but also you can check for patient's understanding, whether the patient can retain the info or not. But if you feel like there's no time or less time left, then ask the patient, do you have any more questions? In that case, it will summarize the patient's understanding in one way or another. Then go to the closing section. We are all here to help and support you. And if you have any inquiries, don't hesitate to contact me at any time. I'll leave my phone number for you with the nurse. And after that, thank the patient and end it. Okay. Now, let's come to the second part. Who is going to, attend this mock? Raise your hands, please. Anyone who want to do the second mock? Mr. PN? Can you please unmute yourself, whoever wants to join? Are you ready? Can you hear me, Mr. PN? Am I audible?
Yes, sir. You're audible, sir.
Okay. So, do you feel like attending, the second mock? This one. This one. Have you prepared for this?
Hello.
Hello. Yes, Miss PM. Yes, sure, you can start. Wait, let me put on the timer on. So you will have 1 minute to read the stem and then another 9 minutes to perform. Okay. I'll be starting the timer now, Mr. Mind 9. Okay. Starting.
Okay, sir.
Okay. Can you read the stem loud?
60-year-old patients with dysphagia, barium solution has been performed and it showed a lower esophageal narrowing and OGT is planned. You have been asked to consult the patient for this procedure as your consultant has gone off for a meeting.
When the clock hits 9, you can start. Okay.
Okay, sir.
Let me remind you, you'll have 9 minutes. You'll be having 9 more minutes before this station. I mean, the performing stations, the prepared
Okay.
stations where you can write down all the necessary information, right? So you have written down
What is
all.
your name in this room?
Mr. Smith.
Okay, sir.
Okay. Please start.
Hello, I'm Dr. Nai. I'm one of the surgical doctors in this hospital. May I confirm that you are Mr. Smith?
Yes, doctor. I'm Mr. Smith.
Yes, I would like to discuss about you with one of the investigation procedures. So, how much do you know about it?
Well, doctor, I don't know much. I've been told that I have to go through some tests which involve some serious procedures to follow. I don't know much about it. Can you tell me more?
Yes, I will explain you in detail. So this procedure is called OGTscopy. In a long form, it says esophagogastroduodenostomy. In this procedure, we will put a small tube into your mouth, and then it will go to the food pipe. It will go to the food bag, and then it will end in the small bowel. There will be a tiny camera in front of this tube, and through this camera, we can see live suction on the TV screen. So, are you following me?
Yes, doctor. It seems painful, doctor. Is there any other way that it can be done?
Yeah, it seems like painful, but please don't worry. If you are worried, then I can give you a sedation medicines, so you will not feel any pain.
Okay, doctor.
So how
Is there that sounds good, doctor? But is there any risk factor, doctor?
Yes, as you know, every medicine has a side effects and every procedure has their good and bad effects. So this procedure also has a risk effects. For example, during the introduction of the tube into the mouth, there will be damage into the teeth, or it can cause a chest infections. Or in this procedure, we will try to take some of the parts from your food pipe. So because of that, there can be bleeding from that area. And there is one complication which is little serious. In this that risk factor is they will be cut through the food pipe, and for that you might need to go an emergency operation.
What? My food pipe can be cut? No, doctor, I'm not going to do this test. There's a lot of risk in this.
Oh, I'm sorry that I scared you. Actually, this is a very rare chance to get this risk. Actually, this procedure is only be done by the surgeon who has a highly well trained and well experienced. So please don't worry. We will try our best so that you don't have any of these risk factors.
Okay, doctor. But can you tell me why I'm salivating so much?
I'm really sorry to you that you are in this condition. I'm really sorry. As you know, we did one of the investigations. So in that investigations, we noticed that there is some narrowing in your food pipe. So that's why your saliva cannot go down and it's coming through your mouth. So please don't worry. With this procedure, we will try to dilate the narrow part so that you can the saliva will go down and you will not suffer this condition.
Okay, now I can understand why it's salivating so much. But do you think, doctor, I'm having any cancer?
I understand your concerns. Actually, we are not sure whether this is cancer or not because this is very early to say. We need to do more investigations. For example, like this investigation also, we will take some parts from the food pipe and then we will send it to the laboratory and the laboratory will tell us whether this is cancer or not. So that's why we need to do this investigation.
Oh, okay, doctor. But when will I get my results?
Normally, it usually gets within 2 weeks, but don't worry. I understand your concerns. So as soon as I get the result, I will inform you.
Oh, okay, doctor. But where will I stay after the procedure?
After the procedure, it depends on what we did. What we use the sedation medicines. If we use just the spray, then you can go after 2 hours after the procedure. But if we use sedation medicines or anesthesia, then you must need to stay in the recovery for more time. So it depends on your procedure. So normally after the procedure, you have to stay in the recovery room so that we can check whether there is any kind of side effects, any kind of complication from the procedure or not. And then if your condition, if you are fully recovered from the sedation, you can go back to your room, to your home. But one of the important thing is you cannot drive your car. You have to arrange someone who can drive you to your home. So is it okay for you?
Okay, doctor, I think I can manage.
Okay. So,
So
is
you
there
have,
anything that you ask
yes,
me?
you can summarize if you want.
Okay. Yes, we would like to do an investigation, which is ogesicoscopy. In this procedure, we will put a tube through your mouth into to your small bowel, and we will try to dilate the narrow part of the tube. Then we will take some part from the food pipe, and then we will send it to the laboratory, and we will get the result within 2 weeks.
Okay, doctor.
And there can be risk factors, but we will try our best that you don't suffer any kind of these side effects.
Thank you, doctor.
Yes, thank you very much. So, do you agree that you want to do this investigation?
Well, based on what you have said, I think it's better for me to perform the exam, perform that procedure, right? So I'll be doing that.
Okay, okay. So for that, you will need to sign one of the paper. So I will just go and get the paper, and then I will give it to you, and you please sign it for me.
Okay, doctor. Thank you so much for your
Okay.
effort.
Yeah. Yes, even after this, if you have any kind of queries or if you want to ask me any questions, please go to the nurse station. I will give my belief number to the nurse for you. Okay?
Okay, thank you so much, doctor.
Yes, yes. Thank you very much for understanding. I will just go and get the paper, and then I will get back to you.
Okay, doctor. Thank you. Okay, Mr. PN, very nicely done. You have communicated with the patient in, a very informative, at the same time, very effective way. And you also empathized with every line whenever I have explained my concern or I have, conveyed my apprehension. You have, defended it very nicely. And at the same time, you didn't use any medical jargon. It was very, understandable, easily understandable for the patient as well.
Okay,
And
sir.
overall nicely explained. Thank you. If you
Okay.
uh, keep it up, and if you keep it up, you'll pass with high marks. I'm sure of it.
Okay, sir. Thank
Yes,
you very much.
Mr. Mind 9, right?
Yes, yes.
Excellent. You are doing excellent.
Okay, sir. Thank you.
Just do like this in your exam.
Okay, thank you very much.
Okay.
So will be the next to perform the mock. This one.
Can I perform if
Yes.
anyone
Yes,
not
yes, sure.
interested right now?
Yes, sure.
Yeah.
So should we start the timer?
Yes, but the screen is cut off. I cannot.
You can see it properly now.
Yes.
What about now?
No, the screen is zoomed out.
Okay, let me
Ye-
help you with this. What about now? Can you see it properly?
mm, Yes. Yes, yes. Now it's okay.
It's okay, right?
Okay.
Okay.
Yeah.
Okay. Then let's start. So you'll be having 1 minute to read the stem and then 9 minutes to perform. And when the timer is 9, okay?
Okay.
I'll be starting the timer now.
Okay.
Can you please read the stem aloud?
A woman who is blind from cataract, dark glasses, and lives alone with history of prosthetic valve, and he is on warfarin. Recurrent hernia surgery is planned for him, so should stop warfarin, but the patient is anxious and afraid to stop warfarin. Already talked to consultant in clinic, but still has some concerns. You have been asked to counsel the patient before stopping warfarin. Okay.
So are you ready?
Yes.
You can start now. No problem.
Hello, I'm Dr. Naz, one of the surgical doctors here covering under my consultant. So I I have been told that you're having some concerns about stopping your warfarin. Can you please tell me what are your concerns about stopping warfarin?
Yes, doctor. Well, I have a artificial valve in my heart, and I have to take warfarin on regular basis because my cardiologist told me if I stop taking it, then I might have a heart attack. Oh, doctor, I don't know what to do. It looks like a big threat to my life.
I totally understand your concern, but first let me explain the whole thing to you so that it would be understandable to you. So about warfarin, it is true that it helps for your prosthetic heart valve that your blood doesn't get clots, and it on your artificial valve. And so when we are going to operate you for hernia, we will stop warfarin, but we will instead start some other medication, which is called heparin, which has the similar action. But our concern about stopping warfarin is it causes bleeding during or after the procedure. So we have to stop it 5 days earlier before surgery. But we will not leave you in any danger, and you will be keep safe when we will start heparin for you.
But why
Oh.
heparin, doctor?
Because when we'll start heparin, it has short duration of action. Instead of we can stop it only 12 hours before surgery. But in case of warfarin, we need to stop it 5 days before surgery. So it is a long time than the heparin. Okay, so your heart valve will be kept safe, and your blood will not get clogged.
Okay, doctor, I can understand where you are coming from. But when can I resume my warfarin?
Well, when we will finish the surgery and when we will monitor that there is no chance of bleeding, we will continue the heparin on you, and we will do some blood investigation, which is called INR, International Normalized Ratio. It is a blood investigations for to start warfarin. So we will monitor that, and after the result, we can review and start warfarin. Okay.
Okay, doctor, thank you. But is it necessary for me to stay in the hospital prior to the operation?
Actually, yeah, you have to stay in the hospital because we need to monitor you till till the end of the operation. Since the start of the operation, we need to monitor you the whole time. So you have to stay in the hospital.
Doctor, but is it necessary to stop my anti-anxiety medication before the operation?
No, you don't have to stop your anti-anxiety medication. You just can take it with a small sip of water.
Yeah, doctor.
Okay, so did you understand me?
Yes, doctor.
Do you have any other queries that you want to know? If you have anything in your mind that you want to ask, you can ask me whatever you want.
At this time, I don't have any questions, doctor. But will you be there in the operation theater?
Our consultant will be in the theater and our surgical team will be in the theater. So you need not to worry. I will convey all the information to them.
Okay, doctor. Thank you so much.
Okay, you're welcome. So we are all here to help and support you and to dive your hand at any time. So please don't hesitate. If you have any other queries or problem, I'll leave my phone number with the nurse. Thank you for your understanding. So to summarize the case, we got a patient to be operated for hernia surgery who has been taking warfarin for prosthetic heart valve. Patient has concern about stopping warfarin. And I assured him that we'll start heparin on him, which will be stopped 12 hours before surgery and will be resumed again 12 hours after surgery, and we'll do some blood investigations to start warfarin again. And he has been told about all the things regarding the procedure, and he has been also told that he has to stay in the hospital before starting the operation and after operation, so that we can monitor him effectively.
Okay. Thank you, doctor.
Welcome.
Okay, nicely done.
Yeah.
So what you have did just now is you have gone through every topic that I have asked you, and at the same time you were quite fluent and empathetic to the patient as well. and the most important thing is you were calm and quiet. You know, in many times, what happens in the exams, we get so much excited, or because of the adrenaline rush, we go into the exam station and we just talk whatever that's in our mind in one go. So what you can see, even after talking for so long, you still have 3 minutes left, right?
Yeah.
So it's quite doable task. You don't have to rush or anything. You can be calm and quiet, and then you can continue the conversation fluently, and you'll get your time easily managed. I think it's really doable thing. So it needs to be, not for you. Obviously, you did good, but for the others, it needs to be kept in mind that time is not the main factor here, because you'll get enough time to speak with patient, but you have to be calm and quiet and be empathetic to the patient. Okay, so
Yes.
nicely done. Thanks for your attending, and very well performed station. And keep it up. You'll do just great. Okay, thank you.
Thank you.
Okay, now about the next station. Does anyone? Okay, can you see the station now? Is
May
it?
I ask a question
Yeah, sure.
to Dr. Naz? Hello, Dr. Naz.
Yes.
Okay, so you have done nicely the whole conversation. One thing I want to ask you, you have summarized the whole scenario at the end of the conversation, right? I want to
Yes.
know to whom you summarize the case, like to patient or to examiner.
To the patient.
Yes, I think then we have a patient. You don't have to say that. Okay,
Oh,
Okay.
in last line that we have a patient who has this disease and this. Just talk to the patient directly and ask
Okay.
him, is that clear or
Okay.
not? Okay. Okay.
Okay.
Thank you very much.
Welcome.
is there anyone else who want to join here? The next task.
If no one is keen to join, I want to again, if no one is available, I can do
Okay,
that
okay.
too. If no one is interested. Yeah.
Yeah. Okay, no problem. If you want to perform, no problem. You're doing great. So should I start the timer now?
Yes, sure.
Can you please uh, can you please say the same loud?
Yeah, a
Because
5-year-old child who has fallen down from a tree. He has brought shocked to the hospital with his father drunk and resuscitated, and first have been performed and suggested a rupture spleen. Now he is operated laparotomy. Now you have been asked to talk his anxious mother to answer her queries. Okay.
okay, you can start 20 seconds. Okay, no problem.
Okay. Hello, I'm Dr. Naz, one of the surgical doctors. So I can see you that you are in a stressful situation. I really apologize that we couldn't contacted you before, and I can tell you everything about your child's condition. But uh, d- could you please tell me if you know anything what has happened?
I don't know, doctor. I don't know much. I just got a call from the hospital that said that my child got injured, so I rushed into here. Could you please tell me what happened to my little child and how did he got injured?
I understand that this moment is really difficult for you, and please have a seat, and I will explain everything you want to know. So we actually received your child in our department, who is brought by his father, and he explained that your child fell down from a tree, and he seriously harmed himself actually, and we apologize that we couldn't wait for you to see him. We had to rush to the theater as it was an emergency case.
Oh, doctor, did you run any investigations like scanning? What is the result of it?
Yes, we did an emergency scan, which suggests that there is an muscular organ in the left side of a tummy, which is called spleen, which is injured in some of extent and which is bleeding. So we had to take him to the theater urgently.
Doctor, is it a serious condition?
So rupture spleen is definitely a serious condition, but we can assure you that your child is in is in very good and experienced hand. Our consultant is a very good surgeon. So this you can we can just there would be no we can just hope that your child get better after the operation theater.
Doctor. But what did his father tell you?
His father told us that your child was playing in the garden and suddenly he climbed up a tree and fell down from a height from the tree and seriously harmed himself. There was a black bluish wound area over the left side of the tummy, and he called an ambulance and brought him here urgently.
Doctor, is it going to affect my child's life?
We cannot say this right now. Your child is in the operation theater, and we also assured you that our surgeon will do anything, whatever he can do for your child's good. So, we will let you know if anything, if there is anything emergency or anything you need to know. We will definitely let you know.
Oh, doctor, it's all because of his father. Because his father is drunk and I want to protect my child. Could you please help me?
I'm really sorry to hear that. First, let me tell you that if you want to take any precaution for your child, we can provide that. So there is some social worker or child protection services which is available. We routinely give this service to all, so that we can assure that your child will be safe at home. So we will do anything best, whichever will be in your child's best interest.
Okay, doctor. But is there any medication which will be required after the operation?
Yes, when the spleen will be removed, he needs to be vaccinated against some infection, as the spleen is not there, and also there some long term of antibiotics will be needed also.
Doctor. But how long could the operation last? Could you take a look and tell me?
Yeah, it is really difficult to say that, as I cannot get into the operation room, that it will disturb the surgical staffs.
But when can I see my child?
You can see him as well as he get out of the operation theater.
So when can I take him back to my home?
After the operation, we need to monitor your child because your child's health is our first priority as he is going through a surgery. So we'll monitor him and review him, and we will do some investigations. Also, we'll monitor his vitals, and when there will be a good recovery of your child, we'll discharge him definitely when our consultant will agree with the good health of your child.
Okay, doctor, as you say, just please make sure my child is properly taken care of.
Sure, we'll definitely try to help your child. And if you have any queries, you can ask me.
No, doctor, I don't have any queries now, right now. I'm so frustrated.
So I can understand your situation, but let's hope and pray for the best. And did you understand what I have told you so far?
Yes, doctor.
Okay, thank you. So we are all here to help and support you. And if you have any queries at any time, I'll leave my phone number with the nurse. You can call me at any time. Thank you for your understanding.
Thank you, doctor. Okay. Are you done?
Yes.
Okay. So you still have almost 2 minutes left. So what you have done in this case was quite good, but you got stuck at a point, right?
Yeah. Stammering.
Yeah. So whenever you get stuck to the point, you have to, get out of it as early as you can, because the examiners will be looking at you and, they'll be holding the pencil to whether to, cut your marks or not. So
Okay.
whenever you feel stuck like that, if you cannot form a sentence, try to think it and, reform the sentence and just convey your message. The main objective is to convey your message to the patient or the relative, the patient.
Okay.
So you just have to, form another structure or whatever it is, you just have to get out of it. Don't get stuck,
Okay.
first of all. Second of all, don't use too many fillers, because whenever you use too many fillers, it will be, negative for you, because the layman examiner and at the same time, sometimes the surgical examiners may cut marks from your fluency. So it will definitely affect your communication skill. Try to make
I didn't get that point. Too many?
too many fillers, like okay.
Oh, all right.
Okay,
All right,
so
all right,
these
yeah.
these fillers are, affect the fluency of the communication. The thing is, we are not used to speak in English. So whenever we try to speak in English, the fillers naturally comes, and it hampers our communication skill, and at the same time it hampers our fluency. So it will be regarded as negative in case of using too many fillers. You can use fillers, but one or two times in a whole paragraph, or your conversation. But it's not like you can use or in every sentence, because it will affect your fluency. Apart from
Okay.
that, you did really good. So I think with some practice, it will be gone. So you don't need to, get so anxious about it. You just keep on practicing, and it will be okay, I guess. Okay.
Yes,
So
yes.
very nice, nice job, a nicely executed performance. So I can see Mr. Mayank Naing is raising his hands. So will you be attending our next mock? This one, Mr. Naing, can you hear me?
Yes, sir. Yes, sir.
So should I start the timer now?
Yes, sir.
Start it. You will
What is
have
the name?
Yeah. Can you please read the stem aloud?
A girl with acute appendicitis has been brought to the hospital by her neighbor. The mother was at work when she was told that her daughter is in the hospital. She became anxious when she realized that Mr. Mann is the same surgeon who did an operation for her husband and who died. You have been asked to talk to her anxious mother to answer her inquiries.
Do you have anything to ask me before we
Yes,
start?
what is the name of the child?
The child's name is Jennifer.
Jennifer.
So are you ready?
Yes, sir.
Are you ready?
Yes.
Okay, you can start.
Hello, good afternoon. I'm Dr. Nai. I'm one of the surgical doctors in this hospital. Are you Jennifer's mother?
Yes, doctor.
Yeah, I would like to explain you about your daughter's conditions. Could you tell me how much do you know about her condition?
I don't know, doctor, what happened to my daughter, little daughter. I just got a call from one of my neighbors, and he told me that he had to carry my daughter to this hospital. I shouldn't have let my daughter alone. I'm feeling so guilty. I don't know how much could you please tell me what happened?
Yeah, I can understand how you must be feeling. It must be really difficult for you to see your daughters in these conditions. I can totally understand. But first, let me explain to you that please don't get guilty, because even though you were with your daughter, this will happen anyway. I would like to explain your daughter's condition in detail. Is it okay for you?
Yes, okay, doctor.
Okay, so your neighbor brought your daughter because your daughter is suffering from pain in the right lower part of the tummy, and so we did
Yes, doctor.
examinations. Unfortunately, shows that it shows that there is acute appendicitis. So, do you know anything about acute appendicitis?
No, doctor, what is acute appendicitis?
Appendix is a small tube-like structure that is situated in the right lower part of the tummy, and in some conditions, this tube becomes blocked, and then this appendix becomes. So, this condition we call acute appendicitis. So, for that, our registrar has seen your daughter, and and some of the IV fluids and the anti has been. So, now for our surgeon, Mr. Mann, to come and operate your daughter.
Are you sure, doctor, that my daughter's got acute appendicitis?
Actually, acute appendicitis is a very common condition, and because of the history, examinations, and the investigation scans, all points towards an acute appendicitis. But we are not 100% sure unless we open and see what is inside.
Is it dangerous, doctor?
I can understand your concerns, and I'm really sorry to say that it can be a serious condition of children, because in the younger children, the fat in the tummy is less, so there is high risk of perforation.
Oh no, doctor. What will happen to my child
Okay,
if there's
I think,
perforation?
I can understand your concerns. I'm really sorry to say this, but please don't worry. We will try our best to save your daughter.
Yeah, doctor. But because of this operation, will my daughter be having any wound?
Yes,
Some-
we are going to cut the skin, so there will be wounds. Normally, we will do just only a horizontal cut, so the scar will be small. But if it becomes a complicated case, then we might need to extend the wound, so there will be a big scar. But please don't worry, we will try to suture it so that there will be a small linear scar.
Doctor, can you make it less disfiguring? Is there any way?
Sorry, I couldn't hear you.
Will the wound be disfiguring, doctor?
Actually, yeah. No, please, we will cut the skin, so there will be scar. But actually, it depends on her conditions.
Oh, okay,
But we will try our best so that the scar will be small.
okay, doctor. But is there any other problem that could happen to my daughter? Is there any other problem that could occur, doctor? Mr. Naim, are you there? Am I audible, everyone?
Yes.
I think Mr. Naim got disconnected. Okay, in that case, can anyone care to continue?
Hello, can you hear me?
Yeah, I can hear you. Mr. Naim.
My connection went out.
Okay, no problem. You can continue, right?
Okay, sir.
Okay. So what I wanted to ask you, that is there any other problem that could happen to my daughter?
Yeah, actually, if this is a case of the perforation, then the infection can spread tube that helps to become a pregnant. So there is some risk that in the future she has a low chance of becoming pregnant.
What do you mean she can't get pregnant in the future?
Oh, I'm really sorry that I scared you. Actually, I doesn't mean that. It's normally a ladies has a two tube. So even if this complication happen, she will have a healthy tube on the other side, and she can get pregnant with the tube.
Oh, okay. But you told me about Mr. Man, right? But
Yes.
Mr. Man did operation for my husband and he died. I don't want my daughter to, go to him.
Oh, I'm really sorry to know about your husband conditions. I'm really, really sorry. Can you please explain me about your husband condition?
Well, my husband had a colon cancer and Mr. Man operated on him. And after that, he died few weeks after that operation at home.
Oh, I'm really, really sorry. Yes, I can understand how you must be feeling. But I think your husband condition, the case is a really serious one. And I think your husband died because of the disease, not because of the operations. And because Mr. Man is one of the highly experienced and well-trained surgeons in this hospital.
Okay. But can I see my daughter now?
Actually, we are planning her for the operations. So I will check and then I will reply to you.
Okay, doctor. Please make sure my daughter is fine.
Okay. I can understand your conditions. Please don't worry. We will try our best to save your daughter.
Okay, doctor, thank you so much.
Okay. So do you have any questions to ask me?
No, doctor. That
Okay.
will be all.
Okay, yes. So after this conversation, even if you have any queries or if you want to ask me any questions, please go to the nurse station. I will give my bleep number for you with the nurse. Okay?
Okay, doctor.
Yes, sir. Thank you very much for understanding.
Thank you so much, doctor. So, Mr. Naim, nicely
Yes.
done. Although you got disconnected, but you continued it nicely.
Yes, sir.
So whatever I said earlier, you were perfect. Or what should I say? You were very empathetic, and at the same time, you were careful about not using medical jargons. I
Okay, sir.
think if you keep on doing this, you'll be passing with high marks. Okay,
Okay, sir.
perfect.
Thank you, sir.
Thank you so much. Is there anyone else who want to join the next mock? This one. I can see Ms. Naz is raising her hand. Okay, no problem. Okay, Ms. Naz, can you hear me?
Yes.
Okay, no problem. Okay, you can start. I'll start the timer for you. Can you see the screen clearly?
Yes, I can see. Okay. So should I start?
Yeah, start.
Male
Start.
patient working as
Yeah.
postman with meniscus injury postponed once or twice before due to long operative list. Now the consultant has been called for an emergency and the operation will be postponed again. You have to talk to the patient and tell him that his operation is cancelled. Patient is frustrated. Okay.
Okay, if you are ready, start now. Start by telling your candidate number. So it will be in your practice whenever you get into the exam center or station, you have to tell your candidate number first so that they can mark against your candidate number. You can start now.
Hello, I'm Dr. Nas. My candidate number is 90245. So
You may proceed.
okay, so I'm one of the orthopedic trainee here covering under my consultant today. So I can see you here waiting for the operation, sir. So
Is it my turn now for the operation?
I know that you have come for your operation, which is scheduled today, but I'm really sorry to say that our consultant is called away for an emergency case to attend, and we are unable to carry out your case today.
What do you mean by that? Do you mean that my operation is not an emergency?
We definitely understand your concern, and I really apologize. And I went through your files, and I can see that your operation was cancelled previously also, and it's been cancelled today also. But you have to understand that our consultant has called away to attend an emergency case. So we have to prioritize that case, and I understand your frustration, but we are really sorry for that.
What? What are you telling me? That it got cancelled again? Would you please call him right now? Call him right now.
Please try to understand. I know that this must be troubling for you, and your operation was scheduled today. But as our consultant is not available right now, and he has been went to attend an emergency case, and we cannot call him now because he won't be able to pick up my call.
I don't know what to say. I'm too much angry. I need another consultant to do it right now.
I understand your concern. It's definitely up to you, and you have the right to choose your doctor. But I'm afraid that the new doctor who will take your case, he has to gone through all your file again from the start, and this might delay your procedure again.
So could you do it?
I'm really sorry, but I cannot do any procedure without any supervision and permission other than my consultant.
So give me another appointment right now. I need this operation to be done now.
I totally understand your concern, but I'm really sorry that I cannot right now give you any available date because when our consultant will be available, and we will schedule all the cases, and once our schedule is ready, we can put you in a date. But I can assure you that I'll prioritize your case and emphasize your circumstances, that your date comes to the next list as soon as session as possible.
Could you promise me that this won't be postponed again?
I cannot say that very confidently, I'm really sorry, because if any emergency again arrives, we have to prioritize that case.
What? You couldn't perform it the last time. You are not going to give me assurance that it can be done the next time. What should I do? I'm not happy with you. I want to file a complaint.
You can definitely file a complaint. You have right to file a complaint. If you want, I can give you the procedure that I can give you the note that where can you complain. We have a patient advice liaison service for the complaint, and they will talk with you and listen about everything you have been through. So, and this will be also confidential, so you need not worry about that.
I don't know. How will the, this procedure called arthroscopy be done? Can you explain it to me?
Yes, it is a camera-based procedure. A thin camera will be inserted through your knee joint, and your joint will some muscles and ligaments will be stabilized with that by viewing with the camera through a scope.
Okay. But is it going to be painful?
Every procedure is painful, but you will be anesthetized during the procedure. So during the procedure, we will feel no pain.
Okay, if you perform that, when can I walk again after that surgery? Will I have to stay in the hospital?
No, you don't have to stay in the hospital. We will advise you some physiotherapy, and we will do some, we'll give you some wearing and tearing. So you can do some non-weight bearing exercise also, and you can also swim to keep your knee muscles strong. So you can do any of them. We will advise you after the discharge, after the procedure.
Okay, but about the pain, how can I work now?
You can we will advise you painkiller that won't irritate your stomach, so you will be fine with that.
But what about my employer? My employer, doesn't comply with my pain. He doesn't give, proper importance to my pain, and he keeps on telling me to work properly. So what should I be telling him?
I understand your concern. We'll definitely try to help you out. I will write everything in the summary paper as a medical certificate, so you can show that to your employer, and you can also seek sick leave with that summary.
Okay, then do that for me.
So did you understand what I have told you so far?
Yes, more or less.
Do you have any other queries?
No, no queries.
Okay, so thank you for understanding. So we are all here help to support you and type your hand at any time. So I'll leave my phone number with the nurse. If you have any inquiries, please don't hesitate to contact us. Thank you.
Okay, thank you so much, doctor. So, Mrs. Naz, nicely performed. You just, improved dramatically. You didn't use any fillers. I could, hear of, but you, improved dramatically. So it was very nice of you to not using any fillers in the sentences, and you were quite, calm and quiet, although the patient was very angry. So the important message here is don't get angry. Handle it professionalism. Okay. Try to give the patient enough space to express himself so that he can get his anger out, but you don't get angry. If the patient stands up from sitting, you don't get up, you just stay calm, sitting in the chair. You offer him another sit. Okay, please sit down. It would be okay, let me see how I can help you, like that. Okay, so you were very, great performance, and nicely done. Keep it up. Okay.
Thank you.
Now about the next station, I can see that Mr. Nang again raised his hand. So, Mr. Nang, are you with us?
Yes, sir.
Okay. Do you want to, perform this next station? This
Yes,
one?
sir. Yes, sir.
Okay. Okay. Should I start the timer now?
Yes, sir.
Okay. Can you please
Shall I
read
read?
them aloud? Yes.
Okay.
Should start.
Yeah. A male patient with massive ascites the ascites has been tapped and the fluid sent to the cytology, which has revealed the presence of malignant cells. Tumor marker sent, pending. Abdominal CT has been ordered, but the CT scan is not working. CT will only be up next week. Radiologist offered to do ultrasound abdomen today. Consultant has gone to attend EOTN. You have been asked to speak to the patient wife who is angry.
Okay. You can start if you want.
Yeah,
Start by
what is
telling
the
your
name?
start by telling your candidate number, okay? Patient's
Okay.
name or the wife's name. What do you want?
Patient name.
Mr. Smith.
Okay, sir.
Start.
My candidate number is 12041.
Okay, you may proceed.
Shall I start? Okay. Hello, good afternoon. I'm Dr. Nai. I'm one of the surgical doctors in this hospital. Are you Mr. Smith's wife?
Yes, but you are not Mr. Man, are you?
Yes, actually, our consultant has been called for an emergency operation. So I'm here to explain you about your husband's condition.
What?
So,
Why is he not here now? He was supposed
sorry.
to look after my husband.
Yes, actually, he has been called for an emergency operation.
Oh, okay.
So, okay. So, before we proceed, can you please tell me how much do you know about your husband's condition?
I don't know, but my Miss Man told me that the previous investigations has revealed that my husband has got something in his tummy which is nasty, very nasty, and he wanted to do some more investigations like CT scan, and I was supposed to come with my husband today to get the CT scan done. That's all I know.
Yes, what you told about your husband is correct. Actually, I want to share you one information. It's not that much good. So, do you want to know about it?
Yeah, I want to know.
Actually, yes. We plan to do the CT scan for your husband, but unfortunately, the CT scan has been broken down today. And then we called for the services, but they said that it will be fine after next week.
Why? What? Is there any other alternative?
Yes, actually, our radiologist has offered to do an ultrasound scan. You might know about the ultrasound scan because we use these ultrasound scans for the pregnant ladies to look inside the tummy. We usually put the jelly and we use some of the stick to look
But
inside.
doctor, my husband is not pregnant. Why are you doing
Yeah,
ultrasound on him?
yes, actually, this ultrasound scan, it can help some of the information. For example, like your husband has a big tummy, so we can use this ultrasound scan to look inside the tummy, and we can see how much amount of the water is inside the tummy.
Oh, okay, okay.
Yeah.
So, will you transfer him to a another hospital for the CT scan then?
Actually, yes. If the patient wants, then we can transfer the patient to the another hospital. For that, I will get the
Then why
permission.
didn't you do it earlier? Why didn't you
Sorry.
transfer him? Why didn't you transfer him earlier?
Actually, we need to get permission from the patient first, and then we need to get permission from the consultant, and then we have to check the patients whether the patient is fit enough to go to the hospital or not.
Okay. As you have told me that your CT scan machine is broken down, so shouldn't you be transferring him to another hospital?
Yes, if the patient wants, we can transfer to the nearest hospital. But usually, we can do this kind of investigations in a 2 week scan. But because of this CT scan, we cannot. Because of this accident, we cannot do the CT scan. Otherwise, we can do the every investigations here. That's why we didn't transfer him to another hospital.
Okay, doctor. But is it cancer, doctor?
Actually, to say whether it is cancer or not, we have to know whether we have to know the origin, and we have to know how much it has spread, and we have to know the treatment plan, and then we can see whether this is cancer or not. So now we just want to confirm whether this nasty cells has spread to other part of the body. So that's why we want to do the CT scan.
Oh, okay, doctor. But do you think that he will need a surgery?
Actually, it depends on his patient, on his conditions. If this cells spread to any other part of the body, then he cannot do the operation. And operation will have severe harm to his body. And if the nasty cells doesn't spread to other part of the body, then he can do the operation.
Okay, but he couldn't breathe well right now. Why so, doctor?
Yes, I'm really sorry to see his conditions. Actually, I have already informed this to our registrar, and our registrar has already given the permission to take out the water from the tummy, because of this tummy swelling, this water is compressing his breathing organs so that he cannot breathe properly. So after removing the tummy fluids, then he can breathe properly.
Okay, doctor, that would be great. But my husband doesn't have any other relatives except his one brother, and he lives in another country. He's a patient with a heart problem. Should I tell him about my husband's condition and ask him to come now?
Actually, we need to do other investigations to confirm the diagnosis. So, and also your husband's brother has heart disease, so we need to tell the news slowly, so that he can bear the news. And also, for my suggestion is, please wait till we do the other investigation scan, and then we will get the diagnosis, and then we will decide the treatment plan. And then please tell everything to your husband's brother.
Oh, okay, doctor, I'll do that.
Okay. So do you have any other questions?
No, doctor. No other questions right now.
Okay. Yes. Thank you very much for your understanding. So I will arrange to do the ultrasound scan. And if you want him to transfer to another hospital, please come to me. I will discuss about this with our consultant. And then I will also arrange to remove the tummy fluids from your husband's tummy.
Okay, doctor.
Okay. Yes. If you have any queries, please go to the nurse station. I will leave my bleep number for you with the nurse. Okay.
Okay, doctor. Thank you
Yes,
so
sir.
much.
Thank you very much for understanding.
Thank you, doctor. Mr. Nine,
Yes.
super. You are
Okay, sir.
actually outdoing every station, so I'm very impressed with you. I hope you'll be doing great like this in your exam.
Okay, sir.
Okay. So unfortunately, the thing is, I couldn't, prepare all the phone call stations in this mock exam today. So what I'll be doing, I'll take only one phone call, and after that, I'll give a generalized idea how to perform in the phone call stations. Okay. So
Okay,
who
sir.
wants to perform in this last station? Please raise your hand. Okay, I can see Mr. Nas. Mr. Nas is raising. Okay, fine. Okay, Mr. Man. Okay. Mr. Naing, as you have performed in the last session, I'll be giving this chance to Mrs. Nas. Okay, is that all right?
Okay. Okay, sir. Okay, sir.
Okay, okay. So, can you see the screen, Ms. Nas, properly?
Yes, I can see.
Okay, should I start the timer?
Yes.
Please read the time aloud.
Yeah, low urine output postoperative day 1 by ward nurse. Patient has tachycardia, low grade temperature, mild hypotension, narrow pulse pressure. Urine output is 10 to 20 ml per hour for last 8 hours. Received 1100 ml of normal saline for postoperative day 1. Last total count is 14, high urea, borderline high creatinine. Your ST1 working for Mr. Mann, calling Mr. Smith, the attending consultant for advice. Okay.
So, Ms. Nas, are you ready?
Yes.
Okay, we start by telling your candidate number, and at the same time, it's your phone call station. So you might get a phone, or you might get a video, monitor where you need to, contact with the with your consultant. Okay, now start.
Hello, I'm Dr. Naz. My candidate number is 94723.
You may proceed.
So I'm ST1 working for Mr. Mann. May I please? I have been called to call Mr. Smith to ask him about a patient who went right hemicolic to me for anesthetical growth. The patient postoperatively is now oliguuric, and there is some change in the vitals. So could I please check that I'm speaking to Mr. Smith?
Yes, who is your consultant of the case?
Mr. Mann is the consultant.
Okay, summarize your case, please.
So
Summarize your
we
case,
got a
please.
patient.
Yes.
Yes, patient to underwent me 24 hours ago for a sickle growth. Right now, the patient is oligouric for last 8 hours. His urine output is 10 to 20 ml per hour. The
Okay.
patient is also tachycardic. Mild hypotension is present, and there is also low-grade fever. The patient is catheterized, and we check the catheter, which is not blocked. And we also checked the abdomen. Abdomen is non-tender and abdomen is lax. But blood investigation shows hemoglobin dropped from 12 to 10. And there is also some changes in the blood urea, which is raised, and creatinine is also borderline high.
Okay. So what do you think the cause is?
I think as the patient is on postoperative day 1 and he received only 1100 of ml normal saline, the patient is dehydrated as he is tachycardic and mild hypotensive. And there is also blood lost perioperatively. We already transfused 2 units of bloods for that.
So what's your plan? What will you do next?
We planned for a fruit challenge. We are thinking about to start a fruit challenge with crystalloid 250 to 500 ml for 15 to 30 minutes.
Okay.
And we will monitor the patient again after the fluid challenge overnight.
Okay. Apart from the fluid challenge, are you not going to resuscitate the patient? With normal saline?
We will at first we will start the fluid challenge, and before that we will resuscitate with normal saline and will infuse it over 1 hour and monitor the patient till next morning. And if the patient needs to transfer to higher dependency unit, we will also do that, inserting a central line. And if needed, we can do blood transfusion also.
Okay. So aren't you going to check the hemoglobin before transfusing the blood?
Yes, as the hemoglobin is dropping, we'll definitely check the hemoglobin again.
Okay, do that next morning. Okay. So do you
Yes.
think that the patient is bleeding?
Right now, his vitals is we are already monitored the vitals, and he's tachycardic and mild hypotensive, but his abdomen is lax. But as the hemoglobin is decreasing, we will do serial hemoglobin as you advised, and we'll also do abdominal examination if there is any signs of bleeding. We can also do ultrasound.
Mute. Anyone, whoever is, no. Okay. I think someone is talking in the background. Please mute yourself. Okay. So, Miss Nas, you can continue. So, is there any anastomotic leak? Have you
Right
checked
now, the
it?
patient is not. Right now, the patient is not toxic at this moment, and the abdomen is lax and non-tender. But we'll definitely do serial abdominal examinations, and we'll definitely do abdominal ultrasound. So we can know that if the patient is peritonitic or not.
That's good. So you have already told me about the fluid challenge, how you are going to, infuse it. And does it require a HDU transfer right now?
We can let you know after the fluid challenge. We have to wait until the response.
Okay, that's good. If the HDU is full, who are you going to speak to?
So I have to speak to the ITU registrar, who is in charge, and I will request him to facilitate a bed by discharging the stable patient or doing repartitioning of patient, so that we
That's good.
facilitate for our patient.
Does he require operation now?
We can't assure that after the fluid challenge and after thorough investigation till next morning.
That's good. Do you want me to come back and see the patient?
Right now, we will start a fluid challenge, and we will update you subsequently. If anything is needed, we'll definitely let you know.
All right. Please do let me know if anything goes wrong. Okay.
Okay.
that will be all. Thank you.
Okay, thank you.
Miss Naz, you have, keep on impressing me, because in this part you haven't used any fillers. After I told you about the fillers, that's great important. I would say great improvement. So in this phone call part, what you have to do in this introduction part, first you have to give your introduction, like where you are working, under which consultant, and at the same time you have to confirm the consultant you want to speak to. And in this blue part, you can see all that. And in this red part, you have to state your purpose of calling, like ask him and or transfer, or give any proper discharge or anything about you want to know from a consultant. You need to state that purpose here. Like here, you say like ask him and advice about a patient who underwent right chemotherapy for sickle tumor, and he has been oliguric now. And now, after that, you have to check whether you are talking to the right consultant or not. You can see in the yellow part, you have to confirm that, right? So
Okay.
then after that, in patient detail summarization, when the consultant asks you to summarize the case, you have to first of all tell the patient's current situation. Like in here, you can see that patient details have been properly, current condition has been properly stated here, that he has been operated 24 hours ago by right hemicolectomy for sickle tumor, and his urine output in the last 8 hours is this, and I have checked for the urinary catheters, which was not blocked, which is the most common case in this kind of situation, right? So after that, what you have to do is you have to tell the patient's vital signs, how he is now, and about his condition. And at last, you have to tell the patient investigation reports, like we do while we do follow up the patient, right, in the hospitals. Like that, you have to tell first the patient's current condition, then his vital signs, and then the investigation reports. And after that, you go into the question and answer session. So in these sessions, the consultant may ask you something, which you have not noticed or written down in your paper from the case notes. So in that case, what you have to do is you have to act professionally by saying sorry, or just saying that I'll check for it. Then if you can check for it within the time, then it's better to check for it. Don't ever make things up, okay? Because sometimes what happens is that the consultant may purposefully ask you some investigation reports which are not mentioned in the case notes. So in that case, if you make things up, so it will bring down your marks. So please make sure that you don't make things up. Then just say sorry, that I'll look into it and let you know. And whatever the consultant tells you, note down those necessary advice if you need it, okay? Because at the end of the conversation, the consultant may ask you about the advices he has given, right? So I think that will be all. And you can see that time is not the main factor here, because you have already got enough time left to end the conversation. So I think at last, I would say that you don't need to get too much hurried or too much anxious about the time. You just go with the flow, act normally, talk fluently, and I hope it will be managed within time. Okay.
Okay.
Okay, nice job. Thank you everyone for joining. And it will be great if you subscribe to our YouTube channel called MRCS Insights. And you can find our group links in the description box of that channel. Okay. So last but not least, all I have to say to you is all of you did great job. And apart from some minor mistakes, you are great, and it will improve with time, with practice. Okay, so no need to get too much nervous. So thank you, everyone. So I'll be leaving you all, guys. Okay. So was it helpful, this mock session?
Yes.
More or less, right? Okay. Thank you for participating. I hope you'll be doing great in your exam. When is your exam, Ms. Nas?
Coaching August.
August. Okay.
Yes, I'm also coaching August.
Okay, okay. So you found a partner here, right? That's good. So you two could be practicing together.
Okay.
Okay. So I will be closing our Zoom session today. Thank you, everyone.
Thank you very much, sir.
Bye-bye.